Ayla is our little miracle. Once she actually came, it was like, it just snapped that it was real and she was there and it was awesome. The first day were, all smiles. And then the second day, the nurses at the hospital noticed the little flickering in her wrist. They knew something was going on, and that's when they took her down to the NICU.
When they took her away from me, it was the scariest moment ever. Unbeknownst to us, Ayla had an in utero stroke. About 15 hours after she was born, she started having seizures.
So I met Ayla in a couple days of life when she was quite ill. That's always a distressful time I think, for families and doctors before we really have an answer for what's going on and know how to treat an individual.
Still, every year, have a really hard time looking at pictures from that day because it was such a traumatic experience. And we're really thankful for the village around us who supported us through it. There's really no better feeling than feeling like you're being taken care of.
When Ayla has a seizure, it feels like nothing else matters except getting her the care she needs. When she was a baby, it seemed like it was happening every 3 months. And then once they kind of got the dosages of medication down, I think she went 4.5 years without having one. Thankfully, at this point, her epilepsy is well controlled under medication.
Ayla does have some minor motor dysfunction on one side of her body from the vascular event or the stroke, but it is so minor. With ongoing intervention and some speech therapy, she's just been more or less a normal kid on seizure medicine.
So over the past year, she's done well?
She's been really good the past year.
Right, can I see you walk, Brian?
It's hard to tell, man. This is just one of those families. I mean, they're just a patient you look forward to seeing.
Yeah, show me your jump shot. When children are at their most vulnerable, every bit of positivity makes all the difference in the world. And when it comes to being charitable, that's really what it is bringing positivity into vulnerable situations. And we've had such an amazing experience in our most vulnerable times at PCH that we give back.
We're teaching our kids that it's important to give back, but I also feel like as a donor, there's been amazing breakthroughs that I've learned about. There's a lot of unique things that Phoenix Children's offers that are only possible because of donors.
Funds that support the Barrow Neurological Institute have been just instrumental in taking us to a whole different level. This center under Dr. Wilfong is really equal to any place in the country, probably doing things that other people don't do. Phoenix Children's has just recruited a top-notch, world-renowned neurosurgeon who's very involved in pediatric epilepsy that will really change the treatment here in this community. And there's a whole another aspect of this, and that's Dr. Kruger's lab that's looking for genetic causes for some of these type of disorders. I think support for those type of programs really makes a big difference.
Thank you for your generosity.